Deep breath in and breathe out. Deep inhale and long exhale. Just another 2 to 3 rounds of deep conscious breathing. From here, let's go ahead, begin with the starting prayer together. Join your palms. Let's begin. Sahana Bhavatu, Sahano Bhunaktu, Sahaviryam Karvavahi, Tejasvinavadhitamastu, Ma Vidvishavahi. Om Shanti, Shanti, Shanti. And then you can go ahead, rub your palms together. Cup your palms on your eyes. And allow your eyes to open with a few blinks. Okay. Sir, can I start with my presentation now?
Yeah, sure.
And sir, sorry, it's a little long. So in between, I will, like, when the time is up, I will stop because I've tried to cover a few back issues, but I'll just try to cover as many as I can.
Yeah.
Okay. Is my screen visible?
Yes.
Okay, thank you. Okay, good morning, everyone. My topic for today's presentation is spine-related disorders and deformities. So the reason I chose this topic is because in my experience as a yoga practitioner and as a yoga teacher, I've had a lot of people walk into the studio with the problem of back pain. Some of them causes known, some causes unknown. And they will just come and say that, yes, it was a disc injury, and they themselves don't know what the injury is. So it's hard for us to, accordingly provide them solutions. So if we understand these different spine-related disorders better, then we can provide the therapy accordingly. So that was the reason for my own understanding. I thought I should pick this topic. Before I begin by explaining these disorders in detail, we'll just have a quick look at what are the, just a quick look at the structure of the spine, the vertebral column. So there are two components when we think about the spine. One is the vertebral column, which is the skeletal component, and that is the one I'm going to be covering. Okay. And then the second is the spinal cord, as we studied, that is a collection of nerves. But here we're going to be looking at the vertebral column. This basically is made up of two main components, the vertebrae and the intervertebral disc. And this acts like a protection around our spinal cord. Like we all know, we have 5 sections to this vertebral column: the cervical spine, thoracic, lumbar, sacrum, and coccyx. And this together is a collection of 24 vertebrae. At birth, it's 33, but then as we age, the 5 sacral vertebrae join to form 1, and the 4 coccyx vertebrae join to form 1. So that leaves us with 24 vertebrae, 7 in the cervical spine, 12 in the thoracic spine, and this is the point for the rib attachment also. There are 5 in the lumbar spine, and then 1 sacrum, 1 coccyx. This is the rough structure of our vertebral column. Another thing to know about the vertebral column is, and that's very important, is the arch that we have in the curvature of the spine. So our spine is not a straight line. We have 2 forms of curves. We have the secondary and the primary curves. it's easy to remember. The primary curve is the curve that is there in the fetal position. So that is concave anteriorly when the baby is born. But as we age, we need to lift our head up, we need to stand up, we need to sit up. So in the neck and in the lower back, we develop the secondary curve, that is concave posteriorly. This is how the spine changes as it grows. Next, let's just have a quick look at what are the different structures or the different components. As I said, there are two main components that make up our vertebral column. The first component we look at is the vertebrae itself. I'm just showing the pictures. I'll share this PDF so you can have a read in detail later. I'm just explaining in my own words and showing pictures for now. Okay. So the vertebrae basically has three main parts here. The vertebral body, that is the bulky part, which does all the weight bearing. Then there is a vertebral arch, that is through which the spinal cord passes. So that's the protective part. And then from it, we have 7 processes, basically 7 bony structures that come out towards the back. And one of those 7 structures is called the spinous process. So when you run your hand down your back and we feel those bony protrusions, that exactly is our spinous process. So apart from that, there are 2 transverse processes, 2 superior and 2 inferior articular processes. That's roughly the structure of a vertebrae. Another important thing to understand is these articular processes. So the top vertebrae, the bottom vertebrae, their articular processes join together to form facet joints. These are important because we're going to go ahead and we have a few problems that happen to the facet joint as well. So this is an important joint in our vertebral column. Then moving to the next component, that is our intervertebral disc. So vertebra is the bone. Intervertebral disc is the soft spongy part. This does all the shock absorption. So our mobility, we owe it to this intervertebral disc. And it has 2 parts. It has an annulus fibrosus, like we can understand from the name, that's the fibrous coating, tough fibrous coating. And the nucleus pulposus, that's the pulp, the soft nucleus center. And this contributes to roughly 25% of the height of our vertebral column. That's why we see that when the person ages, they appear shorter. So there's no other change that happens. It's just that this vertebral disc, it's very hydrophilic. It has a lot of fluid inside it. But as we age, because of that wear and tear, repeated movement, these discs lose their height. That's why the person starts to appear shorter. Yeah. So I think that's it. Yes. Now, just to understand, I'm not going to go into the detail of this. We have, of course, muscles that support our vertebral column. And these are classified into 2 broad categories. There is intrinsic and extrinsic. I've not gone into too much detail of this. Intrinsic muscles are basically the muscles that support your posture, that support the vertebral column as such. Extrinsic muscles are like the muscles of your arms, shoulders, the muscles that branch out from the vertebral column, but that help in more external movement. They don't support the vertebral column as such. And another important structure supporting your vertebral column are the ligaments, like we can see in the picture here. Again, there are quite a few, but the 2 major ligaments that we need to know is the anterior longitudinal ligament, like we can understand from the name. It's anterior, so it runs through the front of the vertebral column. So whenever we are stretching, bending backwards, any backbends that we do, this ligament ensures that we retain or we return back to the neutral position. So it contracts and pulls us back to the center. Similarly, at the back, we have something called a supraspinous ligament. So when you bend forward, the supraspinous gets you back. And like you can see in the picture, nuchal ligament is nothing. It is the supraspinous itself. But when it extends into your cervical spine, it's called the nuchal ligament. But it's an extension of the same supraspinous. Okay. That is just a brief understanding of the vertebral column. So we're going to look at the different disorders that can happen due to malfunctioning in any of these parts, be it the vertebrae, the disc, the ligament, the joint, multiple things can go wrong. Before we go into the disorders, just a quick overview of the different tests that we can do to check these. Basic one is an X-ray. Like we all know, an X-ray will just show you the deformities of the bone. So if there is a fracture, if there is a compression fracture, if any of that, any problem with the joint, all that can be seen in an X-ray. If there's a problem with the soft tissue, for example, a herniated disc, degenerative disc, any of those soft tissue or ligament, those problems need to be can be checked with an MRI or a CT scan. EMR, electromyography, checks the electrical activity of the nerves and the muscles. And the last is this bone density test. This is particularly done in case of osteoporosis. When the bone becomes less dense, the bone mass is reduced, that is checked through a bone density test. So these are the common tests that we usually do for our to check for any issues with the vertebral column. This is just a little different statistics to show how big a problem this is. 8 out of 10 people in the world have a complaint of back pain to varying degrees. Around $100 billion in US every year are spent on back pain related research, treatment, consultation. So $100 billion just on back pain. And it is also in India, it is the leading cause of employees having to take day off work. So back pain is reportedly the biggest cause for that as well. And even though we hear that for doctors recommend surgery really easily, but only 10% of the back pain cases fall in the category that they can actually receive surgery. And even those that receive surgery, 20 to 40% of them are not successful. So that just makes it even more important that we take preventive and conservative methods to handle this back pain, because once we are there, surgery is the only option, and in some cases that is also not the option, and we can see that the failure rate is also quite high. Okay, these are basically the 10 spine related disorders that I'm going to be covering. I'll try to speed through and cover all, but you'll just see how many we can go through. Okay. Beginning with muscle strain. This is, I think, the most basic. It's not only restricted to your vertebral column. A muscle strain can happen anywhere in the body. But because our neck and lower back are are highly mobile, that's why these are more prone to getting a muscle strain. So muscle strain is basically when we end up overstretching a muscle, then a few fibers of the muscle might just pull out, or in very severe cases, the entire muscle gets split, or the muscle separates from the tendon. We know a tendon connects bone to muscle. So this tendon to muscle connection gets broken. So, and these can be categorized as grade 1, grade 2, grade 3, depending upon the severity of the muscle strain that has occurred. Now, if grade 2, grade 3 particularly can be extremely painful, because you can imagine how and how much recovery time that will need. The common causes for this is it's because of muscle weakness. It can happen due to wrong movement, poor posture, being obesity. So anything due to which you put strain on your muscles. And the most common these days are our sedentary lifestyle. So the muscles become weak, and then we sit and then we expose them to a wrong posture. And then suddenly one day when we decide to move, we move with that wrong posture too. So all of this adds up, and we become prone to getting muscle strain. The symptoms, the symptoms will really vary depending upon how severely you have injured your muscle. But it can start from like pain, bruising, you can have swelling. It will, following the muscle recovery also, you will have some muscle weakness in that area. And yes, those common symptoms. The medical treatment that is recommended for this, the first thing to do is RICE method, that is rest, ice, compress, and elevate. So you do these 4 in the order to that particular area to slow down the muscle damage and to speed up the recovery process. Then depending upon as we need, we can take to manage the pain, we can take topical painkillers, we can apply those gels or creams to soothe the pain. These days we get those painkiller patches as well. Any of those, and only in and hot and cold therapy works well, so that helps to manage the inflammation and the pain. And surgery is again an option, but only in very severe cases when nothing else has worked and the muscle is not able to repair naturally. For yoga as well, we want to definitely give therapy. We can help, but the rest period is really important. So we want to focus on the person getting sufficient rest, not overstraining the muscle. Even after recovery, we need to handle that particular, injured area with care. And apart from that, props can be really helpful. So for example, if there was a muscle strain in your lower back, putting a block under your knees when you're doing forward bends, sitting the person up on a height, avoiding standing forward bends, because again, gravity comes into the picture. So that, extends the stretch and that can strain the person. So taking such simple caution, depending upon where the muscle strain has happened, can be really helpful. It can help the person move, strengthen the muscle, but at the same time, it prevents overstraining the muscle. For each of these problems, I have covered the Ayurveda diet and alternate therapy methods, but I'm not going to go ahead with explaining each right now. I'll explain it all in accumulation in the end, because the alternate therapy for most spine disorders is quite overlapping. Of course, there are specifications, but it does overlap. So I'm not going to repeat that again and again. Next, moving ahead to degenerative disc disease. It is pretty evident from the name. It is a degeneration of the disc, and it is mainly age-related degeneration. So like we can see here in the image clearly, just the distance between the two vertebrae in a normal disc, and then when you come to the thickness of a degenerated disc, it has lost height. And why this happens, the causes later, but what mainly happens is, like we saw, discs are very hydrophilic. So because of the various causes, like because of aging, because of the repeated wear and tear, movement, poor posture, so this degeneration automatically does happen in everyone with age. But why we hear it so commonly these days is because of these habits, we just speed up the process. So because of our wrong movement, wrong posture, less movement, and also smoking is known to speed up this degeneration of the discs. So this is a very normal age-related process, but in some people it can cause severe symptoms. So you can have pain. If this disc, because it's degenerated, the two vertebrae come together, and this can pinch onto a nerve root. So we know that spinal nerves come out of the spinal cord. So once this degeneration happens, it can impinge on a nerve, and that can cause numbness and tingling, radiating pain down your arm, depending upon whichever nerve it's impinging. So then it becomes an even bigger issue. Apart from that, yes, you have general, it will reduce your flexibility, it will reduce mobility. Certain movements, because of that reduced disc height, will create severe pain. There might be some swelling. The medical treatment, the process again for all is same. Medically, it's tried to manage with painkillers as much as possible, non-steroid anti-inflammatories they are called. Only when the pain progresses a lot, or if there is inflammation, then they move to the next stage of painkillers, which are corticosteroid injections. Like we saw that they have quite a few side effects. So that is only waited for till the situation doesn't aggravate much. Apart from that, again, hot and cold therapy can work. Physical therapy or physiotherapy can be very beneficial. So certain movements. And the surgical option for this is basically artificial disc replacement. So since your natural disc has lost height, an artificial disc is fitted between those two vertebrae. This is actually quite successful, and that artificial disc works for 10 to 15 years fine. Another option is to remove the disc altogether, and it's called spinal fusion. So the two vertebrae are fused together. So it becomes like the sacrum. Those 5 vertebrae have fused. These 2 vertebrae are fused together. All that does is it takes away mobility from that area. So that area becomes slightly stiff because now there's no disc in between to give you that mobility. So these are the 2 surgical options: artificial disc and spinal fusion. When we come to the yoga remedies yoga therapies that we can provide, we want to focus a lot on decompression. So all these extension poses are good, slight back bend, slight forward bend, nothing extreme. We want to create extension, but also we want to avoid severe twisting. So mobility to the spine is really good. So dynamic mobility, like cat and cow, cobra, down dog, child's pose. We want to basically get mobility into the spine and avoid that loss of flexibility that is gradually happening because of the disc degeneration. And we want to emphasize a lot on correct posture, because the wrong posture will again aggravate the situation further. It will just create more pain. Now the degeneration has happened. All we try to do is manage the pain. Okay. Next, moving into another disc related issue. So these are often confused. Degenerative disc and herniated disc. They are two very different issues. Degenerative disc, like we saw, is where the disc loses height. However, in a herniated disc, we can see here, it progresses through various stages. So your herniated disc starts from a simple case of bulging disc, where the nucleus, the center of the disc, it's just moved from the center. So now it's putting pressure on the annulus fibrosus. That's all that it's doing. In the second stage of protrusion, because of that repeated pressure, a few of the fibers of the coating have broken open. The third stage, which is extrusion, that is our problem that we're looking at, herniated disc. Here, the disc, because the fibers have broken, now some amount of the disc material, the nucleus material, protrudes out from the coating. And the last is sequestration. That is a very severe case where the disc material has completely left the coating. So now it's moving in your vertebral column. The nucleus is free from the annulus fibrosus coating. But it is also important to understand that bulging disc and herniated disc are two different things. So bulging disc is a much initial stage, whereas herniated disc is a much severe stage. When we get someone with either of these two issues, we can understand the difference between the two. As you can see here in the picture, this is what happens in case of a herniated disc. Okay. Now the common causes of herniated disc, again very similar to degenerative disc disease. Aging, yes, is one factor, but apart from that, wrong posture, wrong movement, obesity, lifestyle, all of this has contributed to increase in these cases. The symptoms are also highly overlapping, like degenerate. That's why people tend to get confused with what problem they are suffering from. Symptoms are also very overlapping in the two cases. However, the treatment that we can provide is different, since the problem is different. In medical, one of the medical surgical options that is different here is a discectomy. So as we can understand from the name, tomy means to remove, disc means, so that extra part of the disc which is bulged out, which is protruded out, is removed. Because what that does is when it bulges out, it might press on a nerve, and that causes the radiating pain. So we remove the cause by removing that extra part of the disc. Yoga therapy can be quite beneficial in this case because, again, to imagine, the disc is bulging out from the back. So whenever we do forward bends, we're pushing the disc more, because the vertebrae will come together in the front and the disc will bulge more from the back. In a healthy person, that happens, but the nucleus returns to normal. But if you have herniated disc, that will not happen, and that will worsen the situation. So we need to be very careful. We want to minimize, we want to really support their forward bends. Like I said, with a block under your knees, make it really supported. Keep a good posture of the back, even in the forward bend. Be careful that they do not round their spine. Back bends are very beneficial. So we want to instead push the disc in, if you think of it. So we want to go into back bends, and that to extend and then bend back, not with a rounded spine. So we want to create length and then stretch back. So poses like your Sphinx pose, Bhujangasana, cat and cow, focusing more on the cow stretch, all these Ardha Shalavasana, and then slowly progressing to Dhanurasana. All these, basically, these back bends can be very beneficial in minimizing the pain, and even to some extent reducing the case of herniated disc. So we can provide that kind of therapy. Next, moving into sciatica. So before we understand, so sciatica, as we can understand from the name, it has got something to do with the sciatic nerve. Okay, so sciatic nerve is the longest nerve in our body. It originates from L4, L5, S1, S2, S3. This is from these 5 vertebrae. That's the origin point. And it travels, it's really long. It travels through the back. It travels under your piriformis muscle. So on your buttocks, back of your thighs, it goes all the way down to the sole of your foot. So a slight problem in the sciatic nerve causes pain all the way down this path. Okay. The causes of sciatica can be multiple. So anything that pinches the nerve, we saw two causes already: degenerative disc, herniated disc, then bone, we'll see later, this bone spurs, tumors. Basically, we're looking at anything that will pinch your sciatic nerve at the opening: spinal stenosis during pregnancy, excessive weight gain, or if you have a direct injury to that sciatic nerve by itself. That's a different case altogether. All these can cause the pain of sciatica. It's quite a severe pain, so this depends upon the degree, but again, you will have pain, tingling, numbness. It will cause burning sensation. Even a long standing, long sitting, long walking, anything done for an extended period of time will really aggravate the pain. It will reduce your range of mobility, definitely. It will make that particular leg feel really weak. So yeah, the medical treatments for this, again, we will try to handle the root cause. So of course, surgery is avoided. Initial treatments are just pain management, and then they provide physio or physical therapies recommended initially. Hot and cold therapy to minimize, to keep that inflammation in control, to manage the pain. But when the situation is out of control, then surgery is the only option. Surgery will again depend upon the cause of sciatica. So if it's because of herniated disc, the discectomy is done. If it's because of a bone spur, then laminectomy is done, or else you can do a spinal. So different surgical options can be opted depending upon what is causing the sciatica. In yoga, it is so the most common cause of sciatica is herniated disc. Assuming that is the cause, we focus again a lot on back bends. We focus on some mobility to that leg. But that is just, that's not dealing with the root cause. Dealing with the root cause is when you try to correct that herniated disc issue so that it does not press on the sciatic nerve so much. Yeah, that's about it. One way to check that sciatica is aggravating or it's getting better is, the pain initially starts from the lower back, but when it is progressing, it travels down to your foot. When the pain starts to recover, when you're healing, the pain starts to recede back or it starts to localize. So that's a way of just checking that the sciatica is getting worse or it's getting better. Sorry, anyone has any doubts? Or should I continue? Or should I stop? Sir, do I have time?
Yeah, you can go ahead.
Okay. Okay, next is spinal osteoarthritis. So osteoarthritis, like we know, is age-related arthritis. So age-related degeneration. The two major causes why this happens in the spine is degeneration either of your cartilage that is lining the facet joint, like we covered in the beginning, the facet joint. There's a cartilage, it's a synovial joint. So when that cartilage lining this facet joint is due to wear and tear, if that is degenerated, then the bones of the joint rub together, causing osteoarthritis. The second option that we already saw is the degeneration of the disc. So these are the two main cases that can cause osteoarthritis in your spine. And this bone spur, so it can, osteoarthritis mainly happens in our bigger joints, so either in the knee, hip, or the spine. And when the body starts to feel friction between the two bones, the body starts to tries to make up for it. So body tries to repair the situation by producing an extra bone growth. So the loss of cartilage, it tries to compensate by introducing an extra bone. That is called as a bone spur or an osteophyte. So that actually this body's protective mechanism ends up worsening the situation in some of the cases. But that is why that bone spur comes into picture. The common causes of osteoarthritis, like we know, it's again age-related, wrong posture, wrong movement, all of these. But apart from that, people who have rheumatoid arthritis or different metabolic disorders are also more prone to getting osteoarthritis. Not just spinal, but anywhere. They're more prone to getting osteoarthritis in general. The symptoms, apart from the common symptoms, you might feel a little grinding sensation upon movement. And the pain is the worst when you after long periods of stillness. So especially when you wake up in the morning, and someone who has osteoarthritis, they experience the worst sort of pain at that. So they have to really start moving slowly, get some movement, and then they can go ahead. Medically, again, the therapy really overlaps. It's the same thing. You can do a laminectomy, that is to remove that extra bone growth that has happened. Or the one that is done to cure the problem is a joint replacement therapy. So where that the facet joint that has been damaged, it is replaced with another fresh joint. In yoga, the kind of therapy, so we want to focus on three important components when we're looking at the yoga therapy: stretching, strengthening, and extension. So we want to give good mobility because of that stiffness that is coming in after osteoarthritis. So like again, movements like cat and cow, bhujangasana, down dog. We want to maintain good mobility in the spine. Second, strengthening. So we want to strengthen the muscles of the spine and the surrounding muscles. So planks, side planks, chaturangas, all these will help to strengthen your back muscles. And then the third component is extension. So things like Tadasana, or even when you're doing twisting exercises, you want to extend and then focus on twisting. So you want to correct the person's posture. So yeah, this is the kind of therapy. Blocks, all sort of props, blocks, ropes, chairs. So doing a twist on the chair like Sir showed us, that can be really helpful because that helps to release that spinal compression that we naturally put our body through. Cervical spondylosis. I'm not going to go through this in detail because this is nothing but it is the osteoarthritis of the neck. Uh, at least from what I have understood, it is another term for arthritis of the neck. So when this arthritis is restrained to your cervical spine, it is called as spondylosis. There are other terms also like spondylitis and a few more, but spondylosis is basically osteoarthritis of your cervical spine. So the cause, everything remains more or less the same. One major cause of cervical spondylosis is whiplash. So previously, before the cars were installed with those headrests, a lot of people used to get whiplash when suddenly you break the car or because your head doesn't have support, you get a whiplash injury in the neck. That takes its own time to recover, but even after it recovers, because of that injury, that person can develop cervical spondylosis later in their life. And the rest pretty much remains the same. When we are providing therapy through yoga, we want to focus on neck movements. So neck movements, rotations, but again, avoid, Sarvangasana, Halasana, Matsyasana. So nothing severe to the neck, at least in the beginning. Next, we're moving to the osteoporosis. I think just a few days back, sir mentioned osteoporosis as well. So osteoporosis is basically loss of bone density. In our vertebrae, I'm talking about particularly the vertebrae, there's something called a trabecular bone. That is a little soft, spongy bone. And this bone begins to lose its bone mass. And that's why the bone slightly becomes porous. It loses the strength, it loses its density. And like you can see in the picture, because of that loss of bone density, the person starts to get a stooped or a hunched posture because no longer their vertebra have the strength to hold them upright. So that mainly happens in osteoporosis. The causes, of course, aging is a factor, yes. But apart from that, our lifestyle in terms of our posture, obesity, nutritional deficiency, because it's bone weakness, so vitamin D, calcium deficiency is a big factor. Our smoking, alcohol, and caffeine. These are really negatively. There are studies to show that these negatively impact your bone health. Overall health, yes, but even the bone health. Medications like anticonvulsants and corticosteroids. This is another side effect of corticosteroids where you lose your bone density because again, sir had explained the logic, but so that's another factor. Apart from that, medical conditions like rheumatoid arthritis, GI tract disease, hormonal imbalance, early menopause. If a person has a small frame and less body weight, that means they have less bone weight. So they are more prone to getting osteoarthritis. That's not a short reason, but that can just make them more prone. Family history of osteoporosis can also or basically low bone density can be a factor. And this was just some classification. So normal bone density, then there's osteopenia, osteoporosis, and severe osteoporosis. That's how it progresses. The symptoms of this is that there is pain, there is muscle weakness, all the general symptoms will be there. Apart from that, yeah, I think that is pretty much so the general weakness, and apart from that, the person will appear like they have lost height and they will get that stooped and hunched posture. So that is the most evident and distinguishing factor. Medical therapy, again, from how much I understood, there is nothing much that can be done to reverse, apart from the vitamin and the calcium supplements. There's nothing much that can be done to reverse. However, to prevent further bone density loss, bisphosphonates is the group of medications that can be taken. There's hormonal therapy like a denosumab, which is basically a hormonal injection that can be given every 6 months. Raloxifene for women, that's estrogen injected, and for male, testosterone therapy. So if these hormones are the causes of loss of bone density, then these hormonal therapies can be provided to the person just to stop the further loss of bone density. Through yoga, so one important thing we need to keep in mind, since the person has weak bones and osteoporosis anywhere, if a fall is bad for us, imagine if that person ends up falling because of the weak bones, they are more prone to getting a fracture or a compression fracture. So one element of yoga we need to focus on is to improve their balance, to improve their strength. So at least we want to make their muscles stronger so that they can support the weakness of the bones. And we want to work a lot on their balance, a calm state of mind, so that they are at least calm in the mind, so they reduce the chances of getting a fall, getting injured, and further aggravating that case of osteoporosis by getting a fracture. So that is one preventive thought that we can have when we're giving the yoga therapy. Next, moving into spinal stenosis. So spinal stenosis is basically the narrowing of your spinal canal. Okay, this happens in two main portions. So this can be a central stenosis, or there can be a foraminal stenosis. Central stenosis, like it's clear from the name, the narrowing happens towards the center, towards the spinal cord. Now, what do you mean by narrowing is the vertebral column, which actually protects the spinal cord, then starts to close in on the spine. So then it starts to press on the spinal cord. This can happen in because of herniated disc, degenerative disc, because of a tumor, because of thickened ligaments. Basically, anything that puts pressure on the spinal cord because of the reduced distance. Or the foraminal stenosis happens when it's happening more to the lateral side. So not the spinal cord, but laterally. So laterally from our vertebral column, we have the spinal nerves originating, right? So this basically puts pressure on the nerve openings. So these are the two ways in which spinal stenosis can happen. And the different causes, again, are the problems that we saw previously. This can also be congenital. So a person can have a narrow spinal canal by birth, or else it can be acquired due to the fall, due to the various reasons. The symptoms are very similar again. You will lead to pain, numbness, tingling, radiating pain, weakness, all of those. The therapy that we can be that medically can be provided for stenosis, apart from the normal therapies, is braces. So braces works well to support that narrowing of your so it helps to support the narrowing of your spinal canal. And the rest is to deal with the problem. So if it's because of a herniated disc, you do a discectomy, you do a laminectomy, you can do a spinal fusion, you can remove that bone spur if it is causing the narrowing. So seeing the causes, the different medical therapies are suggested. Through yoga, again, we need to understand the cause. And second, we want to focus on healthy movement, creating space, extension, back bends, supported movement using the different props. I've explained it in detail. You can have a look later. Okay. Next, last two we're left with. Next one is scoliosis. So scoliosis is, so all of our spine, it has the curvature, but it's anterior and posterior curvature. In scoliosis, the deviation or the curvature happens to the side. The spine basically rotates on its own axis and it causes a sideways deviation, like we can see in the picture. A normal spine, when you see posteriorly from the back, it looks like a straight line. But in scoliosis, and this happens only in the thoracic or the lumbar. So the person can get thoracic scoliosis, lumbar scoliosis, or in both, a thoracolumbar scoliosis forming a S shape. Okay. This scoliosis, there are different ways that we can classify it. You can have a look at it in detail. This can also be congenital. It can, it can be a person, it starts from your adolescent age, or it can be adult onset. So the adult onset mainly happens because of this degenerative changes in the vertebral column that causes scoliosis. And it can also be classified depending upon the Cobb angle. Cobb angle means the angle of deviation. So depending upon how much it's deviating from the neutral line, it can be classified as mild, moderate, or severe. Okay. The common causes we saw, symptoms. So depending again of how severe your scoliosis is, it can lead to one shoulder being higher than the other. This is something I saw a case that had come. So one shoulder is more elevated than the other. There is a slight rotation that you can see on the ribs, on the waist. One leg is slightly, higher than the other. And in very severe cases, that is, because of that rotation, it compresses on your respiratory tract, so on your lungs, it creates some sort of a compression. So they have respiratory difficulty. And in very, very rare cases, it can cause digestive difficulty as well. It can compress your digestive tract as well. Medically, so a lot of people who have scoliosis don't even know that they have scoliosis unless they are told so by someone who sees their movement, or maybe as a yoga instructor, when you see someone move, you might be able to see that when they are bending forward or they are articulating their spine, it's not going down straight. So that's that way you can, or when you run your hand down their back, you can feel that slight deviation. So a lot of people don't know, and the deviation is minor. It does not cause any discomfort. So all you need is just some monitoring. Once it's figured out, you can just monitor and see that it's not progressing. Sorry, not you. A doctor can see that it's not progressing much. However, if it's severe and it's, it is congenital and it is started from adolescent age, then there is something that you can do in terms of providing bracing. So if it's really progressing fast, nowadays we have growth friendly braces. So basically the spine is supported with these braces so that when the spine grows, the braces also grow along with it, but it does not allow your vertebral column to deviate from the neutral line. So that's a option. And another thing that can be done at a later stage is spinal fusion. But so yes, so apart from bracing, spinal fusion is another option that can be looked into. For scoliosis, twisting movements are really helpful, particularly if the deviation is on which side you want to twist, twisting movements on that side planks. Yes, so all the different seated and standing twists, side planks, all these are really beneficial for a person with scoliosis. Apart from that, just normal movement. So we want to focus on them having some form of movement so they don't develop pain and stiffness. Just the fact that they create movement can really help to relieve them from the pain and the stiffness that comes in. And the last one that we're looking at is spinal tumors. So this tumor again can happen anywhere in the body. It's basically a growth of foreign tissue that begins to grow. And these tumors can be benign or benign or malignant. Sorry, benign tumors are, again, they are a growth of tissues, but first of all, they grow really slowly. And second of all, they don't really interfere with the functioning of the surrounding area. Unless maybe that tumor ends up pinching a nerve or, blocking something, that's a different thing. But apart from that, it does not interfere with the normal functioning. However, a malignant tumor is more serious. It needs to be dealt with quickly because that will interfere with the functioning of your body tissues. And these tumors can be primary or secondary. Primary means it originated in your vertebral column. So that's why it's a spinal tumor that originated in the spine. However, secondary tumors are the ones that, suppose it developed somewhere else and now spreading throughout your body, it has also come into your spine. So that's a secondary tumor. It can happen in your cervical, lumbar, or thoracic. And also these tumors can be, so this is just depending upon what position of your spinal cord they are in. They can be extradural, means outside the spinal cord altogether. Then intradural but extramedular means they are inside the outer coating but still outside your real spinal cord. And then intramedullary is completely inside the spinal cord. I think maybe sir can explain this better. This is just like what I understood of the three positions of the tumor that we can it can manifest. The symptoms, again, depending upon if it's impinging a nerve or it's creating some problem, the symptoms can appear. The medical surgical options for this are either you surgically remove the tumor or you can do a radiation therapy. Radiation used to destroy the tumor. This is usually done after the tumor is surgically removed, and if some small bit of it still remains, then radiation therapy can be provided. Chemotherapy is using chemicals to remove the tumor. And yes, if it's a benign tumor, then maybe it's not removed and it just sees how it impacts. The yoga therapy for this, again, movement, there's nothing at least particularly that you can do. Just healthy, good movement to the body is good. And apart from that, for spinal tumors and any severe spine related disorders or any sort of disorder, actually, the person physically, the pain that you see is different, but then apart from that, some of these can go like sciatica or spinal tumor, they can go so severe that it interferes with the person's daily routine. They're not able to go to work, they're not able to do what they like. Maybe if someone was playing some sport, they're not able to play that sport. So it can really have an impact on their mental health. That's why we need to focus on that component as well. So pranayam practices, meditation, japa ajapa, so any mantra chanting, deep relaxation, and then there's something called MSRT that it is taught in Esvyasa. So these practices basically that calm down their mind is that must be really included as a part of the yoga therapy. And particularly when you talk to the person, also you will understand that that factor needs to be considered. And yes, those people like where providing yoga therapy is yes, but then we also need to be like a friend, be like a guide to them, provide that sense of safe space where they can share their condition, they can share their progress, they can share their mental state. So not just physically, we want to help them in all components of their life, because maybe in their family they're getting the support but no one understands the severity of their situation. A back pain might just be a back pain for someone, but as a yoga therapist, once we understand the condition, we can be a little more sympathetic and empathetic to their situation and provide them therapy in all spectrum. What I covered in all was just the physical part of it, but of course the pranayam part, the meditation part of it remains constant, and that must really be covered as well. Apart from that, just Ayurveda, I have written in detail in my report, but different Ayurvedic herbs like ashwagandha, shatavari, shalaki, triphala, turmeric, ginger, garlic, all these are good anti-inflammatories, good painkillers. So consulting with the Ayurveda specialist and including this as a part of alternate therapy, those Ayurvedic massages like Abhyanga and maybe Panchakarma Basti. So depending upon the condition, these can be included. Acupuncture, acupressure, hydrotherapy, naturotherapy. So hydrotherapy by naturotherapy. All these, this chiropractic care, that is one very big factor that can really help with spine-related problems. So all these alternate therapies along with the medical therapy can go a long way. And yes, I think so. Finding the right balance, being a good guide to to the client who has come to you, and understanding the spinal problem in detail can really help us become better therapists. So that I finished my presentation. Thank you so much.
Wonderful presentation. Now we are open for the question answer.
Thank you, Akanksha. Very nice.
Thank you. Any questions?
Sir, I would say she really deserves a big round of applause, actually. Content was too, but she really tried her best to minimize it. And personally, I find it very difficult when it comes to musculoskeletal